I got it. Okay, hey Keith, it's Donnie. Shoulder. Your biceps tendon's on the left side of this blue cannula, and so far so good. Let me get like a crisp. Oh, okay. Yes, and the biceps tendon on the left here looks good. As we tug on, I'm going to back out the cannula a little bit so I can get around on the other side. So now as we tug on the biceps here and look as it exits the shoulder, that looks great. We'll come back into the joint and we'll look down at this labrum here. And other than a little bit of fraying, that doesn't really look loose to me. That looks okay. Now I'm going to put in the shaver. Here you go. Just trim back some of that little labral tissue. Look better. I don't think this is causing your symptoms. So it's gone now, just that fast. And now we get another look at the biceps. So again, those are just wear and tear changes, Keith. I think that's okay. I want to look towards the back of your shoulder, so we're going to rotate this way. This is the posterior capsule. That looks good. We can look down the front of the shoulder here. And these ligaments in the front look fine. We can go all the way through and see the inferior recess, so I don't think you have a frozen shoulder. And then here's the rotator cuff. And so on this side, you can see our old stitch where we put a stitch across the tear. See that? You can just get a hint of that blue and white suture top left part of the screen. That looks good. I'll tell you what, guys. Can I get a PDS marker stitch? Just wait a minute. Passing this marker stitch. I don't want to go through the repair. The old repair, I should say. And so in a second, you'll see a purple suture coming down. Okay, and then we'll go off on the video, show you some more in a little bit. Okay, Keith, so we're looking from the lateral side. You can just see the shaver coming in from the back, and then there's the anterior cannula there. And again, a lot of scar tissue here. We're just using our shaver now to help clear out space so that we can see. And this may be the total answer. We're going to make sure there's nothing else going on, but this may be the total answer as to why you haven't really progressed like we want you to. So already with the shaver and suction attached to the shaver, we can see a lot better. So we'll keep working here, show you some more in a little bit. Okay, Keith, so we've cleaned this up a lot, and now we can kind of see the subacromial space. That blue cannula's coming in the front of the shoulder, shaver's coming in the back. And so I'm going to do a bit of a revision decompression, which means just take off a little bit more bone up here. It's not a lot to take off because we already did most of that work the first time, but just want to make sure that there's nothing remaining that may have grown back or that may be stuck in soft tissue up here. So that's the next step. I think we'll show you the rotator cuff also in just a little bit. Okay, Keith, what we're showing you here, this is the distal clavicle. So we've done a bit more resection of the bone here just because we don't want this to obviously cause any pain. So now that we're cleaning it up a little bit, it'll be easier to see. So that fresh cut edge of the bone there, that's the clavicle. We're looking from the side, the shaver's coming in from the front of your shoulder. And I'm just making sure that we've removed enough. So as we walk down here and look, we can push on the clavicle. And that looks fine. You have at least a width and a half of the shaver, which means we've got 6 or 7 millimeters resected, which is good. Okay, and so now we're going to look at the rotator cuff. I'll show you some more in just a little bit. Okay, so there's the marker stitch, so we know where to look. We're going to go and pull the marker stitch now. Pull it out. Yep, just pull it. Just out? Uh-huh. Okay, so now that's out. Now we'll just clean up some of the synovial tissue around it so we can get a good look at the cuff here. Remember, we put the marker stitch just anterior to the repair, which was a partial repair, which means that those sutures are going to be back in this region here. But actually, you've done a pretty good job healing that. Healing wasn't really the problem. You kind of opened it, you created a and it certainly looks a lot different being better now than it did before. You just got a little bit of bleeding. We'll take care of that in a minute. Okay, now Keith, this is the very back of your rotator cuff as I rotate. And it looks fine. As I externally rotate, we're going to see the anterior part of the cuff. And I'm way lateral because I wanted to make sure we're not missing something way in the lateral aspect. So now we're going to look up towards the anterior cuff. And again, as we rotate, everything looks good. Here, go ahead and put the weight back on the yellow, please. So now we've seen far lateral. Yeah, okay, so I'm comfortable with that. I don't see anything else to worry about. Those sutures are healed over. So I think it was just a lot of scar tissue just to give you the answer that we're looking for here. We will be finishing up here and getting you back to the recovery room shortly, okay? So I really hope this does the trick for you, buddy. Okay, we'll talk to you soon. Bye-bye.